be here? Like, what am I going to talk about? They may not have enough going on for weekly sessions. It's always funny because like I'll talk to like weekly clients about like stepping down to like bi-weekly when it's like, oh, we've made a lot of progress. We moved past some of these humps, you know, we're in a different stage. We're months later after seeing each other. I was like, but I'll tell them the only thing is that when you drop down to bi-weekly, if you miss one of those appointments, you're now going a whole month without therapy unless you can get in somewhere else. And they're like, oh no. And so a lot of them will stay weekly just because it's like, I may miss. And so it's one thing to go, you know, a week without therapy. It's a whole other thing to go a whole month without therapy. And it's like, if their life is just chaotic and they can't balance it, yeah, okay, I get it. I do feel like some people are not really suited for weekly. I think that some people need to be at bi-weekly just because, like I said, they don't have tons going on, or they need time to be able to think and apply skills in between. And so when you're looking at those types of people, it's like, yeah, you need to take a break and not be here every time, because it becomes almost a dependence on us because they're not given time to think for themselves. Or it's like I was telling somebody earlier about like the high of therapy, and how like after your therapy appointment, you know, that good feeling and, you know, being like, oh, I got this figured out. I got this kind of feeling. It will last maybe about 3 to 4 days. And then it'll die back down and you'll go back to your normal where you were before. And so when I tell people about like coming to therapy weekly, it's like, if you come weekly, you only have a few days of it dying back down before you come back in for that second hit. But we also don't want you to become addicted to therapy, where you're constantly coming here to get that high.